be mindful that your energy impacts everyone around you, including your animals. And so if you're coming home from a really bad day and you've got an animal sitting at the door who's been waiting all day to see you, take a few breaths before you walk in the door, center, so that you can go in and that they can feel some good energy, and they don't have to feel that because they take it in and they absorb it.
Welcome to the Pet Care Report podcast by Pet Summits. Here's your natural cat healthcare host, Dr. Meghan Barrett.
Okay, so this is the Pet Healthcare Report, and I've got Dr. Erin Holder here. Dr. Erin is my colleague and friend. She's an amazing holistic veterinarian who recently moved to Hawaii, and that's how we met out here. And she has an amazing background. She started a hospital in Florida called Florida Wild that is a huge full-service veterinary hospital out in Florida. And she started and managed this practice for many years before selling it to move to Hawaii. And she uses all sorts of different modalities for holistic medicine for both cats and other animals. But I know that a lot of the ones she uses are acupuncture, food therapy, herbal therapy, and is more recently doing a lot more energy healing modalities. So we'll be talking about that today for how we can help our cats. So thank you again, Erin, for being on the show.
My pleasure. Thank you for having me.
You're welcome. So now that we've talked a little bit about your background, can you tell us a little bit more about how you have helped cats in your career? I know you've basically dedicated your life to veterinary medicine, and just tell us about some of the tools that you've used and what you have seen to work really well for cats.
So I instinctively knew in veterinary school that there has to be a better way to take care of all animals, particularly cats. Cats are tricky. They're very different than other species. They are independent. They are difficult to medicate. They're very opinionated. So if you try to switch their food, it's going to be an argument. So you have to get creative with cats. And, even in vet school, I was able to see as the, current, that was, 20 years ago, but the current treatment was dry food and put them on this prescription diet and make sure that they're fully vaccinated. And now we're watching, at that time, fibrosarcomas pop up. So it was an easy segue for me right out of vet school to go and do acupuncture training, learn how to feed animals properly with food therapy, particularly cats. And then over the stretch of my career at Florida Wild, it then became learning about the owners, what the owners could do, what I could do in a veterinary practice. Because again, it's not a dog, where we can get away with so much with dogs. With cats, it takes finesse. And so that was a large part of my practice. What can I do? What can I get away with cats? And also understanding the balance of not pushing too far with them and realizing that the stress that they endure just coming into a veterinary hospital adversely affects their health. So we have to make sure, so we have to make sure that when we're in there, that we are very mindful of not going too far, where we might know, like, we really want to do this ozone treatment, but this cat is just not willing and doesn't want it. And so being mindful and respectful of that has been like maybe my greatest lesson. And then learning how to finesse cats and how to understand when clients say, look, I can't do this with my cat. And instead of getting frustrated or mad at the owner, because I too had a cat that I could not medicate, which was a great lesson for me, to be mindful of what we can do. And if we can't do what I want, then we're going to shift over and see if the cat will allow it.
Yeah, I definitely agree about having to be very creative when we're treating cats. It's no two cats are the same.
Absolutely.
They help us to become as creative as we can to help them.
Yes.
So what were some of the issues that you would commonly see with cats that you would help them with some of your holistic therapies?
I think our biggest one is obesity. And, in our practice, we quickly eliminated the unnecessary vaccinations, backed off completely, just gave, especially indoor cats, like it's just a nonsense to continue to revaccinate indoor cats. So we were able to navigate that situation right off the bat. And then as the practice, changed and I got more educated, we were able to incorporate lots of different modalities. So there's some cats that just are absolutely wonderful and accept acupuncture needles. There's some cats that will accept ozone therapy. But I think the biggest thing that we saw was just getting them on the right diet to prevent all this, autoimmune disease. We saw, we would see stomatitis cases from food allergies and inhalant allergies. And then I had a few practitioners join me later on, and they're like, how come we never treat diabetes here? Like, it's so rare. Like, we'll get the referral diabetic patient, but we just didn't see it a lot. And that was because we had instilled like the whole Florida Wild Veterinary Hospital was this foundation of feeding correctly, minimizing vaccines to minimize the immune inflammation and response, and try to keep it on course and corrected.
That's great. We'll definitely circle back to some more nutrition in a little bit here. So I wanted to ask you, so now that you've focused a lot more of your practice on energy work and energy healing, can you tell us a little bit about that and what you've been doing and how can this modality be used with cats?
Oh, yeah. So my favorite new topic that I'm studying and learning about. And, as I study and learn it, I realize that I have been practicing energetic medicine my whole time as a veterinarian. I didn't understand that administering a pharmaceutical drug is practicing energetic medicine. Giving a vaccine, performing a surgery, whatever treatment that we do, this is energetic medicine. But it's not recognized that in the conventional world, right? So we are treating the physical body. When we're conventional doctors, we see a symptom and we suppress it with a drug. And that is actually energetic medicine. We're shifting the energy.
Yeah, that's really interesting.
It's totally true. It's true. So I've been doing this all along. I'm just now fine tuning it and understanding that there's definitely more than just the physical body. And I think especially veterinarians intuitively know this. Like, we go into a room and those of us that are sensitive, we look at a patient and we're like, oh, that patient is going to survive. Like, that patient has that will, that drive, the shen, whatever you want to call it. Or we go into a room and we think, oh my gosh, this is a very bad case. It's a very sad case. We're already reading the energy in the room. We're practicing intuition. Medicine.
Yeah,
absolutely. So then right after vet school, I shifted into acupuncture, and I was still much in the scientific mind. I knew I wanted to step out of the box, and I knew I was going to. But thinking about acupuncture as a needle going into a spot that stimulated a nerve, right? So I'm still in the mind of the physical and the physical body, and knowing that I'm talking about energy. Qi is the word in Chinese medicine. We're moving qi, we're moving energy. Pain is energy block, disease is energy stagnation. So we're putting these needles in to move the energy around, but still not fully understanding that acupuncture is energetic medicine. And so as I shifted, and herbals and everything, we're shifting animals' energy. We use herbals to, hot dogs or hot cats that are panting and have red tongues. We use herbals to cool them down. So, we're shifting the energy. And then because of a lot of reasons and, self-preservation, sold the practice and moved out to Hawaii and connected with a wonderful energy healer here and opened up my understanding more of the chakra system, the meridians. Of course, I knew as a Chinese practitioner, but how they interact with the chakra system. And so then the energy medicine just really expanded for me. And it's a simple thing to do with your animals. And my goal and mission in life is to work with owners to help them meditate and raise their vibrations. And just by raising the vibrations through meditation in your home, you are creating a much more healing environment. How many, especially you as a veterinarian, how many patients do you see come in and the cat has diabetes and the owner has diabetes, right?
Yeah,
so this energy is shared in the home. And so we need to work with healing the owners and the animals. And then again, how many times do you see an owner come in that's holding their beloved animal and they just cannot let this animal go, and they're just devastated, and this animal's absorbing all of this energy.
Yeah.
And then we as veterinarians absorb all that, right? So we have to learn how to protect ourselves. And so we have to learn how to protect the animals. So by helping humans, we can help the animals and we can help the world. So that's my new mission.
So would you say that when you're doing these more energy focused healing sessions, a lot of the work is focused on helping the owner and the pet to strengthen their bond and realize how they're affecting each other.
Yeah. So that's exactly what it is. And the why I said that is because like when you tell an owner, and you know this because you're such a great food advocate, but when you tell an owner, this is your beloved animal, I want you to go into the kitchen and spend an hour preparing the food, right? 9 times out of 10, they look at me and say, Dr. Holder, I will do that for my cat. Now, I don't do that for myself, but I will do that for my animal. And so for me, tapping into that desire, that bond and love of animals, we can get owners to help themselves because they're motivated by helping their animal.
Yeah, it's really beautiful to think of all the ways that we could help people to, heal themselves through that motivation to help their animals.
Absolutely.
Yeah, that's a really cool way, just that the animals will inadvertently help us. And yeah, I love, in my book, I talk about that, just different ways that my pets helped me to start to cook for myself and learn about my own nutrition through being passionate about theirs and helping them. And then that's turned into a lot of good advice that we've been able to share with other pet owners too.
Absolutely. And there are teachers, like every case, that you see is teaching you something. You're just constantly being taught and led by animals. And it's really, beautiful. And we have a whole support system of animals supporting humans, right? And so we as humans, we need to help ourselves and we need to give back to our animals in that way. So by helping ourselves, we can give back to our animals.
Yeah, that's so awesome. Do you have any easy practices that someone could do with their cat to start on this path?
Yeah. So there's a lot of information out on the website and even on the internet, and just even sitting with your animals in the same space and getting into a meditative state for 15 minutes a day will help you slowly raise vibrations. And so I am working to put together something for owners so that owners can watch and learn and help their animals. And so that will be available at some point. But even now, just, sitting quietly, I think people get really frustrated by trying to meditate because there's this false sense of, my mind has to be completely blank. And that's just not true. And if you sit down at a meditation pillow to think that's what it's going to be about, you're going to fail and you're going to get frustrated. And then you're in the presence of your animal who's picking up those frustration vibes.
That's great. Yeah, I'll have to do that with my cats.
Yeah.
They do like to sit with me sometimes when I meditate.
They're such energetic beings. Like cats in particular are incredible. Feel it. They are so much easier. Where a human might take an energy session, of an hour, a cat may take 5 or 10 minutes because they're so receptive. They don't have this mental block, so we can work with them on very deep and powerful levels.
Yeah. And I just feel like cats in general can be very zen. So like even just doing acupuncture on a cat, I've noticed that they tend to just go into this trance almost as soon as the needles are in, so much more than any other animals that I work with. And I'm sure you've noticed that too. Yeah.
Yes.
As soon as the needles go in, they just calm down. It's pretty remarkable to see that.
So true. Yeah. Cats are really amazing.
Yeah, I totally agree. So I know that you're also a big advocate of ozone therapy. Can you tell us a little bit about that and how you think that could be beneficial for cats as well?
Well, in every single living species, ozone therapy is wonderful. It got a bad rep. I won't drag this on too long, but it got a bad rep way back when it was first introduced because people didn't really know how to use it. And they associate ozone with the toxic ozone gas in the environment. And ozone used medically as medical grade, which means that medical oxygen is electrified. The O2 splits into O1 atoms. They reconfigure as O3 ozone. And that's very unstable in the environment. And so we take the ozone gas and we'll administer it rectally, or we'll mix it with blood and reintroduce it intravenously or subcutaneously or at acupuncture points. There's lots of cool ways to do that. Then that O3, that unstable, if it hits the rectal mucosa or the blood, quickly associates to become oxygen, pure oxygen, and O1. And that O1 is a free radical that I know that we think, oh, free radicals are bad, but some are actually really good. And so that free radical quickly binds to lipids, usually to create peroxidase, either hydrogen peroxidase or lipid peroxidase, and that ignites the immune system. So we have, that we could talk for hours and hours about how our immune systems are all in trouble. We are berated by toxins. We have toxins in our aluminum can cat foods and all of our, vaccines and medications. in our water, in our air, in our ground. We're so toxic. And so our immune system gets confused. And now we see cancer, we see autoimmune disease on the rise. And so by trying to ignite that immune system, because, it's very, very good at following the general, but sometimes the general leads them into places that it shouldn't go. So what ozone does is it backs it up, wakes it up, and helps it get on a path of not being too overly aggressive. And it also will help ignite it if it's too depressed. And so we also add oxygen to the body. Aging is oxygen depletion. My mitochondria are dying off. They need oxygen. They need ATP. And so ozone can do all this. So many, it's just a huge conversation to have about how ozone can help pets, but it's one of the most awesome therapies. And I'm working right now with O3. Yes, I'm working right now with O3 vets to get a course for pet owners so that they can do it at home. And we're working with my own company to get a program for veterinarians and veterinary staff so they can learn how to do ozone therapy.
Yeah, that's so awesome. I definitely plan to dive into that and learn more about it because I know how amazing it can be. And
it is, and it's simple.
If you have a cat that has some type of chronic illness, I would recommend for the listeners to, look at if there's ozone therapy available in your local area from any holistic vets.
Absolutely. Yep.
Yeah, I think it's one of those things that I think if you ask a conventional vet about it, they might not even know that that's a possibility. I think some vets would know that it's used in human medicine, but it's less known and it's too bad because of how powerful it is. So hopefully it becomes more mainstream.
Well, exactly. And we've just got to change the thinking on it as far as it being a toxic gas that the FDA prohibits use. It's just ridiculous. It's used widely in Europe. It's one of the first line of therapies. And so we've got to shift that thinking in the US.
Yeah. Yeah. Plenty of things that get kind of demonized from just one thing that they're associated with that, a layperson might know about.
Absolutely.
So yeah, it's great to be busting some of those myths and letting people know that it can be really helpful.
Yes.
So yeah, circling back, like we said, to nutrition, I know we both agree that nutrition is the foundation of health. So what would your approach be to feline nutrition and, just some of the common things you see people doing or assuming that you would, advise to do or not do?
Yeah, when I first started so long ago, there were a few amazing holistic veterinarians that had already hit the scene. And so when I talked to my clients about please eliminating all dry food, there's no place for dry food in cat health, it was a new concept for them. They were very surprised. They were ingrained with their veterinarians that they needed dry foods for the health of their teeth, which if anybody looks at cat vomit, you see that they very rarely chew their food. If they eat dry, they just vomit up whole pieces. So that's a myth. And that don't change their food, right? Oh, they keep them on one food. And so this is, I spent that enormous amount of my time when I first set up Florida Wild talking to owners about it. But all it took was a few minutes because owners were like, oh, yeah. Or I should say guardians. Guardians were like, oh, yeah, that makes sense. It doesn't make sense that we're doing this. And so, now we're battling the kidney disease and the diabetes from high carb, poor food. And so, we spend so much of our time trying to fix the problems that could have been prevented by nutrition. So the most important thing for me with cats is that they try a raw food diet. The problem with the raw food diet with cats is that once they're on a carb diet, it's very foreign to them. And also their gut microbiome is set for a dry food. And so now if you introduce a raw food, you're going to have a massive lactobacillus die-off in the gut, and you're going to get the screaming, diarrhea, and the owners are going to call you, my cat can't tolerate this. So, we got to educate the clients that transition to a raw is very important. And then some cats aren't going to do it. And so then maybe we could consider a dehydrated raw food or a home cooked diet. And so those are, again, my favorite. So 100% whole food, even if it's just a little bit on top, we want to shift there. And then absolutely no dry food whatsoever. And then potentially worst case, but better than dry food is canned food. But we have to acknowledge that there's toxins and aluminum in the canned food that have been linked to hyperthyroidism in cats. So we do what we can do. It's very difficult and it's very patient. And I work with birds too. And so getting birds converted to a healthy diet is just a labor of love. And you dig in, and you try to get that conversion very slowly and very carefully. And then your health problems are just going to be enormously improved with your pets.
Yeah, I always try to let people know that if they have a kitten and they are feeding them dry food, at the very least, they should offer wet food sometimes to make sure that the cat knows that that's also food. If you're
Yes,
raised on kibble forever, then some cats don't even recognize meat or other types of fresh foods as food, which is pretty
exactly.
astounding.
No,
So,
that's exactly right. And also, we're fighting against companies that put food addictive and flavoring scented things in their food. So how do we fight that with whole food,
yeah, yeah,
So it's very difficult. So when you're
yeah.
a young veterinarian, you tiptoe nicely and you say, "Oh, you really should do this." But when you get to be an old veterinarian like me, you say, "No, this is what you're doing. You cannot feed dry. You are going to kill your cat." So
Yeah.
there's some benefits of being the old gal on the block.
Yeah, it is. Sometimes you have to be a little stern.
Mhm.
I think people appreciate you being honest with them too, because there
Yes.
is so much marketing that just says, dry food is fine, it's healthy, it's what everyone feeds. So why would you feed anything else? But if you look at it that
Yeah.
way, it's almost like, well, yeah, they tell us that Doritos and Cheetos are food too, but they're
That's
really
right.
not. They're
Yeah,
they're super processed,
exactly.
and yes, they're edible, but is it nourishing?
Yes,
No.
they're edible. Yes,
Yeah.
exactly.
Yeah, and, it's
Exactly.
like the food scientists make it delicious and irresistible. So
Mm,
I think that's a big reason why a lot of cats do get obese, is because they're kind of overfed and undernourished eating these dry foods. It's like someone eating chips all day, where you're eating and eating,
exactly.
but you're really not getting what your body needs. So it's so much easier to overeat, instead of, if you
100%.
eat protein, then you're going to feel satisfied pretty quickly, and just be done eating when you're done. So,
Exactly. And it's like you set a bowl of cat food out for a cat and they go and they get that carb insulin spike and then their blood sugar drops through
oh
so
yeah.
then they're laying down and then they have to go back to get more because their insulin all day long is
Yeah.
on this like roller coaster. It's devastating. I mean, it's devastating for them. Period. Like that's the end of the story. Yeah, there's nothing further beyond that. It's just you just can't do it.
Yeah. So it's really cool to just have support in changing the narrative around food, because it's just crazy how the mainstream narrative about food and nutrition is so different than the more holistic integrative approach. And so I hope
Absolutely.
that cat guardians and owners can feel powered to at least have the discussion with their veterinarians, or, there's a lot of good information on the internet. There's holistic consultants like you and myself that are happy to chat with you too about nutrition, instead of necessarily having to convince your vet to support you in feeding that if
Yeah.
they are not on board with it.
Yeah, absolutely. And then, sometimes that's you got to be in a space with your veterinarian where it's a two-way street where we can bring, and it's the same with, even humans, we have to be able to bring our concerns and we have to be advocates for our own animals.
Yeah, absolutely. So, what is your number one tip that you would recommend pet owners to go away with today and implement right now, besides the dry
Hmm.
food thing we just said?
I think, in line with energetic medicine, I have to go back to that and say, be mindful that your energy impacts everyone around you, including your animals. And so if you're coming home from a really bad day and you've got an animal sitting at the door who's been waiting all day to see you, take a few breaths before you walk in the door,
Oh,
center so that you can go in and that they can feel some good energy and they don't have to feel that because they take it in and they absorb it.
yeah, that's so true. And yeah, like we're their whole world. So it
Whole
really does
world.
make a difference. I love that. Thank you.
You're
So
welcome.
thank you so much for your time today. Where can our audience learn more from you and find you to kind of follow everything that you're teaching and sharing about?
So, my website is bodyinbalanceforanimals.com, and I am working on putting together my new vision, which is learning to meditate for yourself and your animals. So, hopefully, that'll be up and running in the next few months. And then I am on Instagram. I'm really bad at social media. I'm working on it, but my Instagram handle is body balance for the number animals.
Awesome. Yeah, those will definitely be linked somewhere along with this episode. Depending on which platform you're listening on, you can definitely find those links and websites. So, for all you listeners out there, thank you for your time. Please follow, subscribe, and leave reviews if you found this interview interesting. This will help us to reach more pet owners who might also benefit from this information. But yeah, thank you so much again for listening to the Pet Care Report. And this was Dr. Erin Holder and myself, Dr. Meghan Barrett. And we'll see you guys next time. Thanks, Erin.
You're welcome. Thank you.